Welcome to the Patient as Teacher orientation video. I'm Jory Simpson, a breast surgical oncologist and course director. Over the course of the next 30 minutes or so, you're going to hear from a series of speakers, starting with Stephanie Mooney, a patient experience advisor who will be discussing the best way to share your stories. This will be followed by Amy Hindle, who will be discussing the role of the group facilitator. Jennifer Schultz and Demetra Turnbull are two patient teachers who have participated in the program before, and they'll be providing you with their perspectives. This will be followed by Dr. Simone Levy, a clinical psychologist, who will be discussing the role of emotion and trauma when revisiting past experiences. Finally, Dima Saab will share her experiences having been through the program as well as a medical student. There's been a shift in the healthcare landscape to focus more on patient-centered healthcare, and medical education must evolve to better prepare our future physicians for partnering effectively with patients and their families. There's so much to learn from your lived experiences and through both your positive and negative experiences with the healthcare system. Students can't learn this from textbooks and online. Rather, only through listening to your stories and lived experiences can we as physicians begin to understand the true impact of illness in the context of your life. One of the greatest limitations of surgical clerkships is that students only get a snapshot of patients at a certain period of time. For example, a student may have assisted in your operation, and that may have been his or her only encounter with you. They would have not been present at your initial consultation or at any follow-up visits you may have had. This limitation prevents them from seeing your entire longitudinal journey. The Patient as Teacher curriculum aims to overcome some of these barriers within medical education. This concept isn't new, and we know there are many benefits to students from programs such as this, such as they begin to develop a greater understanding of illness, and a greater sensitivity to patients' experiences, and an appreciation of the active role patients have in their own healthcare. It also broadens students' view of medicine and the ability to reflect on their role in healthcare and in society. Finally, it's been shown to enhance their confidence in communication and in clinical skills. In the Patient as Teacher curriculum, former patients like yourself volunteer your valuable time to share your insights with third-year medical students while on their surgical clerkship. They, in return, are afforded an opportunity to reflect on the stories you have shared. The objectives of the curriculum are to provide students with the lived first-hand experiences from cancer survivors, change existing perceptions of surgery that students may have, and contribute to the learning and practice of compassionate and socially responsible care. The curriculum entails a series of 3 workshops that are embedded within the 8-week surgical clerkship and integrates humanistic and patient-centered approaches into undergraduate medical and surgical education. The first 2 sessions are led by patient teachers like yourself. It is during these sessions you will share your story with students. The setting is informal and not meant to be a lecture with PowerPoint presentations. It usually takes place in a small room around a table at a hospital and is led by a facilitator. The most important aspect of the program is that for 1 hour, the curriculum content is created by you and should be based on what you think future physicians need to know about what it's like to be a patient. There'll be no physicians present, especially anyone who's been involved in your care. The purpose is for you to speak freely without limitations and to answer students' questions honestly. The 3rd session is in the last week of their surgical clerkship. It's led by a surgical faculty and provides students with an opportunity to reflect on what they have learned through sessions 1 and 2. It is during this session that students present their creative reflection piece, which will often act as a launching pad to powerful discussions. Artistic reflection can have many benefits to the study and practice of surgery and medicine, and it can also be personally rewarding. Arts-based approaches to medical education challenges students to think in a way they might not be familiar with, and has been found to increase students' empathy and ability to understand someone else's perspectives. As you can see, this can be delivered in many different ways.
Storytelling is really a way for the patients and family members and caregivers to get across emotions of the experience that they had in a way that caregivers could understand and empathize with the story. So whether the story is positive or negative, it's a way for patients to bridge that gap between the patient and somebody that you can empathize with, so a person. Stories told by patients, families, and caregivers can be powerful tools for bringing about constructive change. Hearing emotional and personal stories has been shown to boost the levels of oxytocin in the brain, which results in the feeling of empathy. And really the purpose here is to share positive and negative experiences with healthcare providers in a way that will help them appreciate what it looks like to be a patient, family member, or caregiver. When you're thinking about planning and developing your story, there may be some questions that you want to consider. Your story is a precious resource, and it's important to plan ahead for what you're willing to share and how you will share it. You should use your story thoughtfully and wisely and consider some of the following questions. What am I willing to share? What do I feel is too private to share, and what does my family not want me to talk about? Only share what you're willing to share. Another important question is, what will my story teach those who are listening? And finally, have I had a negative experience that's still bothering me, and will it be difficult to share that in a constructive manner? If you still feel angry about certain situations or an event, and do not think you can talk about it in a helpful manner, it may be best not to share that part. You can also talk about it with someone who you trust. Ask for ideas about how to share that part of your story in a way in which people will listen. When it comes time to develop your story, I think there's a few tips and tricks that can help you. First, you should identify a theme, a topic, or a specific part of the story that you want the audience to hear. Think about your journey as a patient, a family member, or a caregiver, and specifically think about times that stand out for you when you experienced a positive, negative, or mixed experience. What were you thinking in that situation, and how did you feel? What fears did you have? And what was the impact of this experience on you or your family? I'd focus on 3 main points and identify the experiences that illustrate these points. And it's best to focus on experiences rather than individuals. You should try to avoid using the name of doctors, nurses, and other staff. If you talk about another facility where you've received care, please don't mention it by name. And finally, make it personal. Speak from the heart, be honest and authentic. It's okay to use humor in these situations or personal anecdotes, and conversational language will make your story engaging. You should also consider speaking with your workshop facilitator ahead of time. They can act as a coach, review your talk, help narrow your focus, and give feedback prior to the presentation. It might also be helpful to use your story to illustrate the core concepts of patient and family-centered care. This is defined as an approach to planning, delivering, and evaluation of care that is grounded in mutually beneficial partnerships among healthcare providers, patients, families, and caregivers. It redefines the relationship between and among consumers of health, patients, and healthcare providers. In this situation, there's 3 principles that focus on care at the bedside that might help you. Dignity and respect, communication and information sharing, and participation and empowerment. For dignity and respect, can you think of a time when you felt like you were really heard and listened to? Or an incident where your knowledge, values, beliefs, and cultural background were incorporated into care planning and decision making? What about a time when these didn't happen? How about a moment when your provider acknowledged you as an expert in your own experience? For communication and information sharing, when you received your diagnosis, was the physician sensitive to your emotions? Did they ensure that you had all the resources available to answer your questions once you had a chance to absorb your diagnosis? Was there ever a time in your care journey when your providers took the time to ask you what you wanted in terms of the amount of information provided or how often you wanted to be informed? For participation and empowerment, can you think of a time when you were encouraged to ask questions and voice concerns? Was there a time when providers did an exceptional job of ensuring that you and your family knew about who to call and when to call for help? When the time comes to present your story, it's important that you've had time to practice. Public speaking can be stressful, but it's important to acknowledge that what you're doing is important and your audience will benefit from hearing you speak. Practice your message ahead of time and make sure you can be heard. If you don't know the answer to the question, say so. You don't have to know all the answers. If people ask you questions that you don't know the answer to, it's okay. You don't want to answer a question, it's okay to say that as well. Expect that some people may be deeply moved by what you have to say, and you also may be emotional. That's fine. You should be prepared for emotional reactions. Listening to stories, either positive or negative, can result in a range of emotions, and in many instances, silence tends to follow a story. This silence is important as it often reflects a combination of discomfort, compassion, and reflection. And finally, speak with authority. You are the expert of your own lived experience. You should trust your audience and remember that you are the one in control, and they are there because they want to hear what you have to say. If you start to feel uncomfortable, look for a familiar face in the audience, perhaps the workshop facilitator. So I finally wanted to finish with thanking the patient teachers for taking the courage to share their story with us. And for any information that they still would like to find out, they can go to the patient teacher website in the resource page and find tips and tricks on how best to develop their story and share their story.
So the group facilitator is a part of every session and is there to welcome both the learners and the patient teachers to the session, to give everybody a sense of how the session will work, to make sure that our learners introduce themselves to the patient teachers. The patient teachers have an opportunity to introduce themselves as well to the learners. The facilitator also helps make sure that the session is a safe place for both the learners and the patient teachers, that should anybody feel uncomfortable or feel like they're not safe, the facilitator can help manage that by clarifying misunderstandings and shutting down any questions that might make someone feel uncomfortable. So a group facilitator, I like to think, is gently guiding the experience. Really, the learners are there to learn from the patient teachers and more fully understand the experience of a patient. So the facilitator will help guide the session by clarifying any points that may be confusing, or if there's any deeper investigation that needs to happen, they might help ask some questions to refocus. They also make sure that the parts of the session are broken up to a certain extent. We want to allow the patient teachers to have the time and space to tell their stories and to really deliver the messages and themes that they have identified as important for themselves, as well as for the learners to understand about their experiences. But we also want to make sure that our patient teachers have an opportunity to tell their own stories, so that there's adequate time for both teachers to share their stories, to bounce ideas off of each other. They may have differing opinions or differing ideas about what's important to them. So we want to make sure that the timing is balanced and that we don't have one person feeling like they need to speak to the whole 50 minutes, but that we're sharing those opportunities and breaking up the curriculum, so to speak, so that everybody stays focused and interested. So as the facilitator, and certainly my experiences over the past year facilitating have been really to allow the patient teachers to tell their stories, to share their narrative, and really to act as, like you said, gently reeling in if we're going off topic or we've been talking about a particular subject matter for a long time, just to bring it back to allow us to move on to another topic, perhaps to take a break should somebody have a question, or to allow the other patient teacher to offer their perspective. With some of our sessions over the past year, we've had very engaged and curious learners who have an ability to reflect while the patient teachers are speaking, and they're ready with questions almost immediately. One of the things as the facilitator that I try to do at the beginning of the session is to check in with the patient teachers to see if they mind having questions in the middle of the session or if they'd rather wait till the end. But sometimes you do have a group of learners who are quiet or who maybe aren't at the place yet where they feel comfortable to ask questions, or they're not even sure what questions they might ask. So as the facilitator, that's my opportunity to pull out some of the themes that may have come up in the curriculum that the patient teachers are offering, to ask questions myself, perhaps of the learners, to stimulate further questions that they might want to ask. The other thing I've done when we've got a really quiet group of learners is remind them that this is a really unique opportunity, and it's not often that they'll have this time to sit with patients who are willing to share their experiences and want to be part of their learning experience. So I'll remind them that it's okay to ask questions, and that's what the patient teachers are here to do, and remind them that we're here to make sure that people are feeling safe and comfortable.
Hi, my name's Jennifer. I'm a patient teacher. Participating as a patient teacher involves talking with the students several times a year, and we get to choose which sessions we want to do, and it involves telling them our story, our individual stories, because all of us have different experiences having gone through breast cancer. And the goal is to not only give them our story, but hopefully impart to them some wisdom on how to better relate to their patients when the time comes. My experience has been wonderful. I see it as a way to give back. It's also, I think, for me, a bit of the healing process. To tell my story helps me come to better terms with what I've been through. It's not a question of acceptance, I've accepted it. But I do think there's a healing aspect for me personally. I also think I've become a better teacher as a person, if that makes any sense. I'm not a teacher per se, but just to relate to other people, to give them a part of me that is not normally spoken of. And for me, it's allowed me to grow as an adult, as an individual, and as a woman, and as a patient. And if you're with another patient teacher, that person's experience is different. So I'm learning from the person who's with me, the fellow patient teacher. And I learn also from the questions from the students. They might ask a question about a part of my treatment or my experience that I really hadn't thought deeply about. They might pick up on things that I don't normally go, wait a minute, I need to think about that. And so it's helped me grow, and it's helped me heal. It's a mutually beneficial experience, at least for me it is. You do not have to tell every aspect of your treatments or everything you went through. Only what you're comfortable. Do not push yourself to reveal more than you are able to reveal to anybody. Because it's more of a medical setting, there is a bit more freedom, there's a lack of judgment. But the most important thing is to remember that the students are here to learn from you, and your story will teach them. But I think the key is only give what you're comfortable with. No one will expect you to delve into the deepest emotions you might have had going through treatment or surgery or anything that would make you squirm in your own chair. The students are very open, they're very open-minded, they're very lovely to talk to. But just remember, this is your story and you tell it the way you want. For the medical students, I think what's most important is that they hear our stories not just as a story, but as a lived experience as a patient.
Hi, I'm Demetra Turnbull. I'm a patient teacher who's participated in the program from the beginning. Being a patient teacher involves being in the session with medical students in 3rd and 4th year, where they get to listen about your experiences as a patient having gone through cancer, specifically breast cancer. So we like to be able to tell our stories, and it's a great opportunity to share what kinds of trials and tribulations we had, what worked really well with us when we were going through treatment, and how we communicated with the doctors. It also gives us a great opportunity to be able to share our own experiences of what we'd hoped would have happened instead, but also share the kinds of things that were really successful and what worked for us. For a physician, being able to be empathetic and being able to balance that with their expertise as a doctor is an amazing ability that takes time and practice and experience. So by being a patient as teacher, hopefully we're providing a bit of a springboard of experiences for medical students so that before they even go into their medical practices or their rotations, or if they're a part of the rotations, they have some food and thought about what the patient experience might be like, what their own life experiences might be, what would it be like for them to have a mother, daughter, friend go through cancer, how would they feel, and be able to bring those experiences into their own medical practice. Being patient as teacher has been an absolutely wonderful, rewarding experience in my life. It's been one of the best experiences in my life because it's given me the opportunity to take something that was a lemon and to make it into lemonade. It allows me to think that, well, maybe this has been a gift having cancer, and hopefully by participating in this program, I'm able to help other people. I'm helping to give my son an example that, maybe not the best things happen in your life, but you can take those experiences and give something back. And that's what I would like to do with this experience, is be able to talk to medical students, share my story, let them know a little bit more about as a person what I'm going through or what I have gone through, and hopefully give them a little bit of better perspective of what they might encounter, and also some things to think about. And also say to them, you know what, I want to validate the fact that you've chosen this profession, because obviously you're someone who cares. So if we can help you just a little bit by letting you know what we've gone through in order to help you in your future, that to me is one of the most gratifying things that I can do in my life. Some advice I would give to someone who's considering to be a patient as teacher would be just to go in it with an open mind and an open heart. It gives you the opportunity to share your story to people who are going to be working with people just like yourself in the future, and gives you an opportunity to share some of the things that went really well during your treatment, things that you appreciated that your physician did for you, and perhaps some of the things that you noticed that you would have hoped that would be different. It gives you an audience of people who are interested and who absolutely have an effect on people going forward in their career. It's great to be able to share your story. It's great to be able to bounce ideas off of another patient teacher who'll be with you during a session. And it's great to be able to have the opportunity to hear what the perspective is of the medical students and what kind of experience they've had in their rotations of what they've already noticed. And being a part of this program allows me to hopefully carry that torch and pass it on to somebody else and say, you know what, this is a unique opportunity for you to be able to share your story and help shape the physicians in our future.
I was asked to discuss how your experiences as patient teachers may impact you emotionally and how to take care of yourselves throughout this time. I first want to highlight that many people who experience a potentially traumatic event or some adversity in their lives, such as having surgery and or being diagnosed and treated for cancer, continue to function very well in their daily lives. They generally feel okay emotionally, they are able to return to school or work, they socialize with friends and family, and continue to engage in the activities they enjoyed in the past. Sometimes, however, people struggle after going through a potentially traumatic event. I say potentially traumatic event because the same event that may be experienced as traumatic to one person may not feel traumatic to another. I'm highlighting all of this because I don't want you to think that you should be struggling emotionally. If you are feeling good and continue to feel that way, that's great. At the same time, however, it's important to know that if you are struggling in some way, that you are not alone and that it is also common to have a difficult time after facing adversity. It is also important to consider that for some of you, painful feelings may come up when retelling your story, and taking care of your mental health is crucial during this time. It may be helpful to practice telling your story to a close friend or relative before beginning your patient-teacher position, and pay attention to how the retelling of it makes you feel. Notice if there are certain parts of the story that feel too painful to speak about. If so, it is important to remember that you do not need to speak about these areas of your experience if it feels too hard. If someone asks you a question that feels too painful to speak about, it is also important to know that it is okay to say that you do not feel comfortable speaking about that particular area. Creating boundaries like these that make you feel emotionally safe will be very important while acting as patient teachers. If while teaching you unexpectedly start to feel overwhelmed with feelings, it is okay to stop and take a few deep breaths, drink some water, and take a bit of time before resuming. If you continue to feel overwhelmed with difficult feelings, perhaps skip over that particular part of the story. I would recommend thinking about what helps you to feel calm before you begin teaching and telling your story, so that you can use these tools if and or when you need them. For example, if you begin to feel very upset or anxious, it may help you to take deep breaths, or perhaps to think about an image or a memory that helps you to feel calm. Self-care will also be imperative while acting as patient teachers. Regular exercise is very important to manage stress, and it can help to balance your mood if you are feeling down or anxious. Make sure to eat a healthy diet, get enough sleep, talk with close friends and family, and continue to engage with activities that you enjoy, including some that feel relaxing. If you begin to struggle emotionally while preparing to be a patient teacher, during your time as patient teacher, or afterwards, it is important to seek support. You may feel better after speaking with a loved one, but if the difficult feelings persist, it may be a good idea to seek professional help. I would recommend consulting with a professional if you begin to feel sad, anxious, or irritable on a daily basis, and if you experience symptoms such as trouble with sleep, eating, low energy levels, difficulty with concentration, flashbacks or nightmares, avoidance of certain people, places, or things, panic symptoms such as a rapid heart rate or shaking, persistent feelings of fear, guilt, or shame, feelings of detachment from others, difficulty experiencing positive emotions, and a diminished interest in engaging in your daily significant activities. I hope that your experience as patient teachers is only a positive one and that it feels rewarding, healing in some way, and empowering to be a part of this wonderful and incredibly valuable program.
So as medical students, I think oftentimes it can be quite a steep learning curve. We're learning to juggle many different priorities, issues on the ward, learning new surgical procedures and the anatomy, and studying for exams, trying to meet the expectations of our preceptors. And unfortunately, I think sometimes we can get so bogged down in those things that we lose sight of why we're there in the first place, which is to care for patients. And I think one of the challenges for medical students on their surgery rotation is that oftentimes we don't often get that longitudinal experience with patients. So we might be meeting them for the first time, say 5 minutes before they're called into the operating room. And in that context, unfortunately, we can start seeing patients as sort of existing in a vacuum, devoid of their stories and devoid of what makes them them. I think one of the risks of that is that we can fall into the just another phenomenon where we start seeing patients as just another lumpectomy, just another hemicolectomy. And so I think one of the values of the Humanism in Surgery program is to remind us to keep in mind those patients' stories. Because, you know, for us it might be the fourth lumpectomy we see that day, but for that patient on that operating room table, they've been diagnosed with breast cancer. And what does that mean to them? What does that mean to their families? So I really think the importance of the Humanism in Surgery program is to shape us into types of physicians who don't view patients as just another lumpectomy or whatever it may be, but as individuals with their own stories, with their own fears and ambitions and hopes. And I hope that that's something that we can bring forward as we become physicians ourselves.
I'd like to thank you very much for sharing your valuable time and participating in the education of our future physicians. If you have any questions or concerns, please feel free to contact us at any time. And if you'd like more information, visit the website at patientisteacher.com for other valuable resources. Thank you.